Hi, my name is Dr. Shaun O'Connell. I'm a GP and Medical Director at NHS Vale of York Clinical Commissioning Group. One of the first things Vale of York Healthy Hearts programme is doing to help reduce people's risk of having a heart attack or stroke is to ensure they're prescribed the most effective statins. And this means that some of our patients will receive a letter explaining to them that we'd like them to change onto a newer, better statin. And at that time, it's important they have the opportunity to speak to somebody about that. And I think community pharmacists who work in pharmacies on the high street are ideally placed for that. They'll also be able to answer any questions that patients may have about their new medicine. So questions like, what does my medicine do? How will it affect my body? How do I get the best out of my treatment, and what's the best way to take it? They're all questions that the community pharmacists can answer. If it's the first time that you've been prescribed a regular medicine and that you have to take every day, then often that can be quite a difficult thing to remember. So your pharmacist will work with you and give you some really practical tips that you can use to remember to take it every single day, because it's not going to work unless you do that. If you've had heart disease for some time, you may well now be taking quite a number of medicines, and again your pharmacist has services that can help you, because pharmacists offer a free opportunity to sit down and talk to you about your medicines so that you can get the best out of them and stay healthier for longer. So it's important that whenever you collect your prescriptions, take that opportunity to discuss your medicines with your pharmacist, because that's something you'll almost certainly benefit from. In summary, if you've been prescribed a new medicine, for example a statin by your GP, and you've got any questions, then go and speak to your pharmacist first, as they're usually much easier to get an appointment with you than your doctor, and actually they're the experts in medicines anyway. If you've been taking medicines for heart disease for quite some time, again there's an opportunity to speak to your pharmacist and discuss any changes or any issues you're having with your medicines. Make sure you're getting the best out of it that you possibly can.